The third reason healthcare costs are so high is because of employer-sponsored coverage. Employer-sponsored coverage came through wage and price controls imposed in the 1940s during World War II. In 1954, the IRS ruled that health insurance premiums paid by employers were exempt from income taxation. This led to employer-sponsored coverage and employee dependence on employers for health insurance. Because of the tax deduction, employees who get their health insurance through their employer pay less for coverage. They pay for their health insurance with dollars that have not yet been taxed. Individuals who pay for health insurance on their own pay more. They buy health insurance with dollars that have already been taxed. Employees typically like this system, thinking in error that they are getting their health insurance for free. However, the worker pays for every penny of their coverage through decreased wages. The employee is paying a high price for a policy they cannot choose, do not own, and cannot take with them when they leave. Employees could have higher incomes if they got their full compensation in cash and they purchased their own health insurance policy. If they owned their own policy, they could keep it with or without a job, protecting them from pre-existing condition exclusions that also often come after a job loss. Many employees would never choose to pay the amount that their employer is taking out of their wages to pay for the insurance they have today. Take the example of one New York man who wrote of his decision in an op-ed in the Wall Street Journal. Rather than paying $13,000 a year for comprehensive coverage, he purchased a $2,000 a year hospitalization plan with a very high deductible. He then uses the $11,000 left over to pay for any medical bills that he might have. The proposed healthcare reform bills in the House would prohibit him from having hospitalization insurance and from saving his money. The bill will raise his costs at least 10 to 13% according to the Federal Budget Office. Reason number 4. The fourth reason healthcare costs are so high is government entitlement programs and cost shifting. More than 50% of healthcare will be funded by the government soon. On February 4th, the Medicare actuaries reported that federal and state programs will pay slightly more than one-half of the healthcare tab in the United States. These programs include Medicare, Medicaid, and the State Children's Health Insurance Program. Such government entitlement programs lead to 4 things. 1. Lack of appreciation or gratitude for the services provided. 2. Lack of concern or interest in the cost of the services provided. 3. A decline in charity and charitability. And 4. Moral hazard, the willingness to use more of the services than you would if you had to pay for them with your own dollars. In essence, where entitlement grows, the charitable mission of medicine and the sense of cost consciousness needed to keep costs low is reduced. In addition, because government fails to pay fully for the medical services provided to Medicare, Medicaid, and S-CHIP patients, hospitals and doctors often increase what they charge to private paying patients. This is called cost shifting. Reason number 5, regulation and administration. The fifth reason healthcare costs are so high is the regulatory and administrative burden of government programs and the paperwork and billing requirements of health plans. Medicare has more than 132,000 pages of regulations for doctors, hospitals, and nursing homes. There can be enormous penalties for failing to follow just one regulation. Who can follow all of them to the letter of the law? No one. This makes every doctor, clinic, and hospital susceptible to accusations of defrauding the government, with prison time and draconian fines as possible penalties. Medicare also requires a great deal of paperwork, shifting time away from patient care. This includes government reporting of private patient data, special government treatment and diagnosis codes, complex new electronic medical records, and special evaluation and management documentation. Medicare also has higher administrative costs per person despite otherwise reported. In 2005, Medicare's administrative costs were $509 per person compared to private sector administrative costs of $453 per person. In the years from 2000 to 2005, Medicare's administrative costs per person ranged from 5 to 48% higher than the costs in private insurance. Reason number 6, insurance mandates. The sixth reason why healthcare is so expensive is because of state-mandated benefits. These are services that the state requires every health insurance policy to cover, even if the individual does not need or want the service. The Council for Affordable Health Insurance does a survey on state mandates every year. In 2009, the total across all 50 states was 2,133 mandates. Rhode Island had the highest number of mandates at 70, while Idaho has the lowest at 13. Reason number 7. The seventh reason why healthcare is so expensive is the loss of market competition. The health insurance industry has consolidated into a few health plans, thanks to the HMO Act of 1973. Have you noticed how traditional non-managed care health insurance has all but disappeared? Did you notice that Secretary Sebelius, U.S. Secretary for Health and Human Services, called only the top 5 health insurance companies in for a meeting to talk about premium increases? She called in United Health Group, WellPoint, which includes Blue Cross Blue Shield, Aetna Healthcare Services Corporation, which operates through Blue Cross Blue Shield, and Cigna Healthcare. While there may still be smaller health insurance companies around the country, the health insurance industry has been consolidated significantly into these few big players. The power of the players is evident. When Congress implemented Medicare Plus C, the first managed care plan for seniors, many of the plans dropped the programs and all their seniors when Congress failed to pay the HMOs what the HMOs wanted to be paid. When the Medicare Plus C program was dropped and the Medicare Advantage program was adopted, health plans managed to secure payments from the government that are 12 to 18% more than the government pays for those who are in traditional fee-for-service non-managed care, Medicare. The big players are hoping for big government contracts in the proposed national health care system. But the day the federal government depends on health plans to run a national health care system is the day that prices will skyrocket. As in Medicare Plus C, health plans will threaten to leave the government in the lurch if they aren't paid as much as they want to be paid, or if Congress doesn't force you and me through an insurance mandate to pay them as much as they want to be paid. These higher payments will fleece the American public of their hard-earned incomes, and ambiguous medical necessity definitions in the health plans will allow the plans to withhold your prepaid dollars when you most need the care. Finally, under reason 7, it's also all but impossible to buy a health insurance policy outside the borders of whatever state you live in. Changing this restriction does not take a federal law, but it could be done by state legislators.